Hello everyone. This is the third lesson on the first aid emergencies and strategies. In the last lesson, we studied on the four bleedings, first aid for bleedings, first aid sprains, dislocations, and fractures, and first aid for injuries, and first aid in poisoning. In this lesson, we will study on the first aid in case of a foreign body airway obstruction, first aid in electrical shocks, first aid in health problems, and lastly, first aid in disasters. First aid in case of a foreign body airway obstruction. An object entering the airway can partially or entirely prevent a person from breathing. If the obstruction of the respiratory tract is prolonged, it can also lead to death. In partial obstruction, although the individual can breathe, she has difficulty inhaling and exhaling and can speak even if it is difficult. The individual's core reflex tries to remove the object blocking the airway. In the meantime, the object blocking the airway can be removed. In partial obstruction, the individual should not be hit on the back, which may lead to a complete block. If the partial obstruction lasts long, health support should be provided. First aid support is provided in case of complex obstruction of the airway. In the first stage, if the person is conscious, lean slightly forward and gently tap him or her lightly on the back with your hand. Then, support the person's chest with one hand and strike hard between the shoulder blades 5 times with another hand. After each stroke, check whether the airway has opened. Heimlich maneuver. If the obstruction persists, apply the Heimlich maneuver. The Heimlich maneuver is applied in the following stages. First, stand behind the person whose airway is blocked. Grasp the person whose airway is blocked with your arms just above the navel. Ensure that the person leans forward. Place one hand in a fist in the space between the navel and the lower part of the breastbone. Support your fist with the other hand and apply pressure inward and upward. Repeat the process 5 times. Check whether the airway is open or not after each intervention. If breathing does not open, alternate back blows and the Heimlich maneuver. If the airway still doesn't open, provide emergency medical support. Now, we can watch some videos.
Now we have a case where an infant is conscious, but is choking. We know that because they're not able to move any air. They're not breathing, they're not coughing, they're not crying. They might be gagging, they might be trying to breathe, but they can't get any air movement in or out. If this happens, we recognize this as an emergency. So we're going to activate emergency medical services, call a code, or call 911. Then we're going to immediately support the baby's face with the hand and the arm supporting the baby's torso, making sure to have the head lower than the baby's torso and legs. Supporting with the leg, we're going to give 5 back slaps between the shoulder blades. 1, 2, 3, 4, 5. Support the head and the body, flip the baby over. With 2 fingers right between the breasts on the sternum, we're going to give 5 chest thrusts. 1, 2, 3, 4, 5, about the third of the depth of the chest. If this object has still not come out, the baby is still not breathing, unable to cough, unable to cry, the obstruction is not clear. Because the baby's conscious, we do not have to necessarily look in the mouth to try to find the object, because again, the baby's conscious. So if it does come out, I'm sure the baby's going to let us know that. So we're going to return right back into the back slaps, followed by the chest thrusts, and we're going to repeat this process until the object comes out, the baby is able to breathe, cough, or cry, or the baby goes unconscious, and then we move to the next level of care for the clearing of the obstruction in the baby's airway. Baby, are you okay? They're not breathing, they're not responding. Help! You in the plaid shirt, go activate the emergency medical services and return. I might need your help. They're not moving any air, not crying, not breathing. Still no crying, no breathing. Still doesn't seem to have come out. At this time, the baby started crying and gagging. I monitor the child, make sure that they're okay and they recover well, and that their color gets better. Now let's say that the infant who was conscious and choking has gone unconscious. It is now that we're going to activate the emergency medical services or call 911. Now that EMS has been notified, we're going to go ahead and go right into the chest compressions. Realizing this person was conscious and goes unconscious is why we're not going to re-tap and shout. Make sure you've got your personal protective equipment on, because now we're going into the mouth of the baby potentially if the obstruction comes into the oral cavity. Fingers between the nipples on the center of the chest, 30, 1/3 deep of the chest, 1/3 of the chest deep, chest compressions, at least 100 a minute. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Look in the mouth. If you don't see it, we're not sweeping. If we do see the object with the small finger in your hand, pinky finger, we're going into the mouth with a hooking motion. So we're going to go in, hook the object out, and then attempt our 2 breaths. If we did not see an object in there, we're going to just attempt 2 rescue breaths. So we put the mask in place, give a breath. If it does not go in, reposition the head, give another breath. If it does not go in, return to the 30 chest compressions. We're going to repeat this 30 compressions to 2 rescue breath attempts until the breath goes in or EMS responds, an AED shows on scene, or we're able to turn this over to the next level of care. Baby is just fallen unconscious. Activate the emergency medical services, please. 1 and 2 and 3 and 4 and 5 and 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Oh, yep, there it is. Pulse is present, baby's still not breathing. Continue rescue breathing 1 every 3 seconds. And we're going to continue this until EMS arrives or until an AED arrives. Now, for a conscious child choking between the ages of 1 and the first signs of puberty, 12, 14 years of age, this child most likely is choking from a foreign body airway obstruction, A lot of times it happens with laughter. They might be rushing their food. In this case, the scenario is that she was eating grapes, trying to have a grape eating contest. How many grapes can you fit in your mouth at the same time? And got to laughing and choked on a grape. Of course, some of the signs and symptoms of a conscious choking child would be that they're panicking. They want to get help. They don't know what to do. They're starting to get really scared, anxious. And so they begin to get real wide-eyed. They're maybe trying to gag a little bit, trying to cough, but they can't cough, not moving air, maybe high-pitched squeaking noises. Also looking for signs of color change, circumoral cyanosis, which is blue color around the lips. Any of those signs and symptoms we're going to be looking for to know that this person is fully choking and needs our assistance. I come up to the child and I say, hey, are you all right? Are you okay? They don't respond with a vocalization of any sort. They're not coughing on their own. If they were, we would just help ensure that they continue to cough and try to get it out. In this case, she's not moving any air, and she's showing the universal sign for choking. So with the hands around her neck, we're going to go ahead and say, are you all right? Are you okay? There's no response. She's still awake but not able to speak. I'm going to raise her elbows, find her belly button. With my thumb tucked in, I'm going to go with my fist against the tummy, just above the belly button, and then grab that other hand. Now, realize, too, that I'm lowering myself so that I'm at the level of the child, so I'm not pressing down on the ribs and running a higher risk of fracturing ribs and things like that. I'm getting to the level of the child. I could do that through kneeling, sitting in a chair, maybe sitting on the edge of a couch and bringing the child in front of me as long as they can stand on their own. I grab that hand, and then with inward and upward thrust, I'm going to go ahead and start my inward and upward compressions. I'm going to do this until I get the object clear or until the child becomes unconscious and falls limp. If the child becomes unconscious, we're going to assist the child down to the floor so that we don't incur any more traumatic injuries. We're going to begin with an assessment and move to unconscious child choking. Now, once the child is unconscious, we want to make sure that we begin with an assessment. We're going to look, listen, and feel. The going from standing to laying down could have moved the airway. It could have dislodged anything. We're going to look in the mouth to see if there's anything obvious that we can finger sweep out of there. So the fact that this child went from conscious to unconscious is now the time we're going to activate EMS. Now, once this child is unconscious, we want to make sure that we begin with an assessment. We're going to look, listen, and feel. The going from standing to laying down could have moved the airway. It could have dislodged anything. We're going to look in the mouth to see if there's anything obvious that we can finger sweep out of there. So the fact that this child went from conscious to unconscious is now the time we're going to activate EMS or call a code. So I'm going to call out to the bystander, hey, you. And the brown shirt, go call 911. I've got a child who went from conscious to unconscious choking. I need an ambulance. Please come back. I might need your help. We've activated the EMS system or the emergency medical services in the area. And now we're going to go ahead and look, listen, and feel for breathing. This child is still not breathing. We're going to attempt 2 breaths. After the 2 breaths, do not go in, and I've repositioned and tried again. We're now going to begin our 30 chest compressions, 1/3 to 1/2 of the depth of the chest. And we're going to do 30 chest compressions and then reassess for the obstruction. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 up to 30. Look in the airway, check for obstruction. If you can see it, we're going to go in and hooking motion, sweep it out and attempt 2 breaths. Either breath went in, reposition the airway, attempt 2 more. Neither breath went in. We go back to the 30 chest compressions. We then go back and look into the mouth. If we see the obstruction, sweep it out, and then attempt 2 more breaths. This time the 2 breaths did go in. We're then going to assess for a carotid pulse, airway breathing, and then treat what we find accordingly. In the conscious adult choking victim, we want to establish that the victim is truly choking by asking them, are you choking? If they're not able to cough, breathe, or speak, we're going to assume that they are indeed choking. They may also notify that we can help them by nodding yes upon asking them, are you choking? I'm going to explain to them that I know how to help. I place 1 foot between their feet, find their belly button, tuck the thumb into my fist, and place the thumb side just above my belly button finger. Wrap the other hand around that fist and go inward and upward deeply into the abdomen until the obstruction is clear. If he were a person who had a larger midsection that was unable for me to reach around, I would do the alternative and go under the breast on the sternum, under the breast on the sternum, and do inward chest thrusts. This is the same technique that we would do for a pregnant female so as to not hurt the baby in the womb and still be extremely effective in getting this obstructed airway clear. Sir, are you choking? I know how to help you. He's not breathing, speaking, or coughing forcefully. You in the plaid shirt, go call 911 and come back. I might need your help. Find his belly button, thumb tucked in, fist against the abdomen just above the belly button, inward and upward thrusts. 1, 2, 3, 4, 5. You okay? Are you all right? Oh, you're okay.
That
You're
didn't
okay.
taste very good.
No, you're okay. All right, so now we're on the adult unconscious choking victim. This is the person we were working with when they were conscious and choking. Our efforts did not get the obstruction clear. They were going unconscious, so we helped lower them to ground ideally. And as soon as they were lowered to the ground, that's our cue to access the emergency medical services, call 911, or call a code. At this point, once we lower them down to the ground after calling 911, we're going to go straight to 30 chest compressions. We're going to do those 30 chest compressions and then open the airway. Look in the mouth, check for an obstruction. If we see the obstruction, we're actually going to reach in. Now watch as we reach in here. We're actually going to go with a hooking motion with 1 finger to the side of the mouth, go towards the back, grab that object, and pull it out. Once the object is out, we're going to go ahead and cover the mouth and nose with a mask and attempt 1 breath. We attempt 1 breath. It does not go in. We reposition the head. Attempt another breath. It still doesn't go in. So we go right back to 30 chest compressions. After 30 chest compressions, we put our mask back on the face, attempt a breath. If it doesn't go in, we reposition the head, attempt another breath. If it still doesn't go in, we go right back to chest compressions. If at some point when we try the rescue breath and it goes in, we're going to deliver a second rescue breath and then check for a carotid pulse, no longer than 10 seconds. If we find that there is a good, palpable, or feelable pulse, easily feelable, we know that this person is not in cardiac arrest. But if they're not breathing, we're going to begin rescue breathing. If there's no pulse, no breathing, we're going to go right straight into CPR. So I just lowered him to the ground. He was conscious and choking. Now he's unconscious. Now I'm going to call 911. Hey, you in the plaid shirt, go call 911. I've got a person who's now unconscious from choking. Please return. Let me know that you've called them. At this point, I'm going to start my 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Anything with an attempted breath? Nothing went in. I'm going to reposition once. Try another breath. Nothing went in. I'm going to continue 30 more chest compressions. 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Look in the mouth. Still don't see anything. Try a breath. Didn't go in. I'm going to reposition. Try again. Nothing went in. Continue 30 chest compressions. After 30 chest compressions, if I tried a breath and it went in, I'd give another breath, check for a pulse. If there was an easily palpable pulse, but no breathing, I'd continue rescue breathing. If there was no pulse and no breathing, I'd start CPR.
In this video, you will learn how to relieve choking on an adult and on a child. Use abdominal thrust to relieve choking in a responsive victim 1 year of age or older. Do not use abdominal thrust to relieve choking in infants. If you see someone clutching their throat with their thumb and fingers, this is the universal sign for choking. You should ask them, "Are you choking?" If they cannot respond or simply nod yes, stand or kneel behind the victim and wrap your arms around the victim's waist. Make a fist with one hand. Place the thumb side of your fist against the victim's abdomen in the midline, slightly above the navel and well below the breastbone. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object is expelled from the airway or the victim becomes unresponsive. Give each new thrust with a separate, distinct movement to relieve the obstruction.
If you cannot cough, speak, or breathe, you have an obstructed airway. If you're home alone or just home anywhere and you're conscious and choking, dial 911. I can't speak, but I'm not going to hang up, and hopefully at that point they can trace the call in case I would lose consciousness. Find something to thrust your abdomen over to dislodge the object, whether it be the back of a chair or a countertop, and keep thrusting until your object dislodges. Pick the phone back up and talk to your dispatcher and let them know what happened. If you're pregnant, expecting your baby, and you have conscious choking, obviously you've dialed 911. Don't hang up. And then you want to take your hands, your fist, and go up above the baby bump and thrust until that object dislodges. For choking prevention, think of small pieces, setting upright, and slow down. Hopefully you will not have to use these measures or tips, but if you do, they're quick and could save your life.
First aid in electrical shocks. In our daily lives, we can use electricity for lighting at home and operating different types of tools and equipments. In direct contact with electric current, serious injuries or deaths may occur depending on the intensity of the current. Loss of consciousness, cardiac arrest, respiratory arrest, and burns may occur in the person exposed to electric current. In case of electrical shock, the victim should be given first aid according to the following principles. The shocked person should never be intervened with bare hands and or conductive object. First, the connection between the person and the electric current must be safely disconnected. For this, the current can be cut off from the electrical panel, or it can be ensured that the person is separated from the current with the help of an object such as a non-conductive wooden stick. The respiratory status and pulse rate of the person pulled out should be checked. Her mouth should be checked, and any food, objects, dentures in her mouth should be removed to prevent airway blockage. If the tongue is stuck in the throat, it should be pulled. If respiration occurs, the individual should be placed in a shock position. The pulse rate should be checked. If there is no pulse and respiration, heart massage and artificial respiration should be performed. If the individual has burns on the body, she should not be moved to prevent organ damage. Wounded areas should be covered and wrapped with clean gauze patches. Emergency health services should be conducted, and the individual should be referred to the nearest health institution. Now we can watch 3 videos on electrical shocks.
An electrical shock may cause burns or cause internal damages, or even can be fatal. Don't touch the injured person if he or she is still in contact with the current. Take these actions immediately while waiting for medical help. Turn off the source of electricity or move it away using a dry, non-conducting object. Call emergency if the injured person experiences severe burns, difficulty breathing, irregular heartbeat, muscle spasms, seizures, loss of consciousness. Begin CPR if the person shows no sign of circulation, such as breathing, coughing, or movement. Apply a bandage. Don't use a blanket or towel. Electric shocks can be fatal, so seek help at the earliest.
Crawling babies can get their fingers into all kinds of places in your home. If they put their fingers into electric sockets or appliances, such as hairdryers or phone chargers, it's possible for your baby to get an electric shock. This can be very serious. If your baby has had an electric shock, you might see some of these signs. They may have burns, blistered or charred skin. They may have pain or weakness. An electric shock can make your baby unresponsive. If you think your baby has had an electric shock, you'll need to do a baby primary survey. If your baby is still in contact with the electrical current, turn the power off if you can, or use something non-metallic to break the contact, like a rolled up magazine or a wooden spoon. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is breathing, put them into the recovery position. Cradle the baby in your arms with their head tilted downwards. If your baby has suffered an electric shock and has stopped breathing, you need to start baby CPR. This technique is for use on babies under 1 year old. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the center of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. You may also need to treat burns, move them away from the source of heat, cool the burn or scald by running it under cold water for at least 10 minutes. Don't use ice, gels, or creams on the area. They can damage the affected skin and increase the risk of infection. Remove the clothing from around the burn. If the clothing is stuck to the skin, don't try to remove it. Cover the burn with cling film or a clean plastic bag. This protects it from infection. Serious burns or scalds need emergency treatment, so call 999 or 112. While you wait for the ambulance, treat your baby for shock if necessary. So remember, break contact with the electrical current with something non-metallic. Check if they're responding and breathing. If your baby is breathing, then put them into the recovery position and call for help. If your baby is not breathing, start baby CPR. You may also need to treat burns, so cool the burn with cold water, remove your baby's clothing unless it's stuck to the burn, and cover the burn with cling film or a clean plastic bag. And that's how you treat a baby who's been electrocuted. Thanks for watching.
Now let's cover shock emergencies. In this scenario, we had an individual who was bleeding from an arterial wound and lost quite a bit of blood. Now, they didn't pass out, but they were starting to feel dizzy and lightheaded. So we helped lay them to the ground, and now we're going to be suspect that they either are going into kind of a psychogenic psychosomatic shock, which is more psychological because they've seen all the blood and they're concerned, or they might have lost enough that they're having some hypovolemic shock, which means low blood volume. Either way, the symptoms are the same, and we're not going to take a chance. We're going to treat them. Gloves are on, our shield is available with a one-way valve, and we've checked for scene safety. The scene is safe. They are responding to me. They are breathing normally, and they do have a pulse. So it's still something where we're trying to decide, do we call 911 or not? But as soon as I see that they're pale, that they're starting to lose a level of consciousness or going to pass out, in my opinion, that's time to call 911. You in the plaid shirt, go call 911 and come back. Bring an AED with you if you can find one. And so now we're ready to begin treatment. I want to reassess like I just did for normal breathing and for a pulse. But now I see that they're a little pale. I squeeze the nail bed and turn it white, and then I let go. It takes longer than it takes me to say capillary refill for it to refill. This is an early sign of potential shock. To treat this, I'm now going to explain to my patient what's going on. I'm going to elevate their legs. It's important that you just find something that's 6-12 inches high. It doesn't have to be super high, but you could use a stool, a chair, a box, whatever you have available. Now, I have a blanket here, but you wouldn't have to necessarily use a blanket. You could use coats, you could use newspaper, anything that helps maintain the body temperature of the person that is going into shock, because this is going to help maintain their core body temperature. When they start going into shock, their body shunts the blood from the extremities and brings it back to their vital organs. This makes them very cold to the peripheral. When this happens, the body will only take so long before it thinks it needs to reheat the rest of the body. When it does that, it will vasodilate, and the blood pressure that they do have could drop again. So we want to help combat that by keeping them warm, comforting them, and watching for regular breathing, making sure they're awake. And if they ever change, lose their breathing, lose their pulse, we're going to respond with CPR and wait for EMS to arrive.
First aid in health problems. Individuals with intellectual disabilities may have nutritional, psychological, sleep, and additional health problems, such as physical, visual, and hearing deficiencies, asthma, diabetes, hepatitis, dental caries, obesity, etc. They should be supervised by other members of the family to meet the health needs of quality of life, apply treatments for the solution of health problems, follow up medication, and monitor changes in the individual's condition. Additional disorders such as epilepsy and asthma may be relatively more common in individuals with ID than others, and they may cause different issues. Epilepsy recurs with seizures in approximately 40% of individuals with intellectual disabilities. Since they have limited ability to ask help, they need additional support and first aid from another person during epileptic seizures. In epileptic seizures, symptoms such as screaming, foaming at the mouth, urinary and facial incontinence, loss of consciousness, partial obstruction in breathing, flushing, writing, and fluttering in the head and neck area, and bruising of the lips may occur. First aid practices in epileptic seizures are given below. The patient may fall to the floor during a seizure and cannot take precautions to prevent damage to the head due to convulsions. If there are objects around that are likely to harm the individual, remove them and create a safe environment. Place a blanket, pillow, etc. under the head of the individual who has lost consciousness due to seizure. If the individual's clothes are so tight that the breathing is difficult, loosen them. After the contractions are over, open the airway if it is closed. For this, if saliva has accumulated in the mouth of individual, lay him or on her side and let the saliva accumulated in her mouth come out. Do not try to open the individual's jaw and don't make the individual smell anything. If the person continues to have convulsions and has not regained consciousness for more than 5 minutes, call emergency medical services. This is the video on the epileptic seizures.
A seizure, also known as convulsion or fit, can be caused by a disruption to the electrical activity in the brain, which may lead to uncontrollable contractions in muscles and unresponsiveness. If a seizure occurs, the most common cause is epilepsy, but it can be caused by other things, such as alcohol poisoning, a lack of oxygen, after a head injury, after taking certain drugs, or if someone with diabetes is having a hypo, where the blood glucose is too low. When someone is having a seizure, you may find they have sudden loss of responsiveness, rigid body with arching back, noisy and difficult breathing, convulsive, jerky, uncontrolled movements, saliva at the mouth which could be blood-stained if they've bitten their tongue or cheek, possible loss of bladder or bowel control. Afterwards, they may be confused, tired, and fall into a deep sleep. If you suspect someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when the seizure started and how long it lasts. Protect their head by placing something soft underneath or around it, like a towel, and loosen any clothing around their neck. Once the seizure has stopped, open their airway and check their breathing. If they're breathing, put them into the recovery position. If they stop breathing at any point, prepare to treat someone who is unresponsive and not breathing, monitoring their level of response. Call 999 or 112 for emergency help if it's the person's first seizure, the cause is unknown, they're having repeated seizures, the seizure lasts more than 5 minutes, they are unresponsive for more than 10 minutes, or they've sustained an injury. So remember, protect, but don't restrain them. Call 999 or 112. And that's how you help someone who's having a seizure.
Asthma is another health problem seen in individuals with intellectual disabilities. Asthma is a chronic condition seen in childhood, and symptoms include shortness of breath, wheezing, recurrent colds, and chest tightness. The incidence of asthma in individuals with intellectual disabilities is approximately twice of the incidence in individuals with typical development. Approximately 12% of individuals with high intellectual disabilities may have asthma and periodic asthma attacks. Families should be informed about the characteristics of individuals with asthma attacks and precautions. In asthma attacks, individuals with intellectual disabilities may need emergency assistance. In case of asthma attack, assistance should be done by the following. Sit the individual upright. If the environment is stuffy, ventilate the room. If the person in the attack is wearing clothes that make breathing difficult, such as neckties, belts, etc., loosen them. If the individual is taking asthma medication, help them take it. Advise the victim to remain calm so that she can breathe regularly in increases. Do regular breathing exercise together. If there is no improvement in the individual's condition within 5 minutes, seek assistance from emergency medical services. This is 2 videos on child and adults asthma attacks first aid.
In an asthma attack, the muscles of the air passages in the lungs go into spasm. This makes the area narrower, making it difficult to breathe. This can be triggered by an allergy, a cold, or smoke. At other times, someone may have a sudden attack with no obvious trigger. If you think someone is having an asthma attack, there are 5 things you may see. They may have difficulty breathing or speaking. They may be wheezing. They may be coughing a lot. They may be distressed, anxious. They may have a gray-blue tinge to their lips, the earlobes, or the nail beds. People with asthma usually know how to deal with their own attacks by using a reliever inhaler, usually with a blue cap at the first sign of the attack. But if they don't, or if the attack is severe, you may need to help. When treating someone having an asthma attack, keep calm. Reassure them and advise them to use their reliever inhaler straight away. Advise them to use a spacer if they have one. Amy, use a spacer reliever. Ask them to breathe slowly and deeply to help control their breathing. Sit them down in a comfortable position. If it doesn't get any better within a few minutes, it may be a severe attack. Get them to take 1 or 2 puffs of the inhaler every 2 minutes until they've had 10 puffs. If this is their first attack, the attack is severe, they're not getting better, they're getting worse, or they become exhausted, call 999 or 112 for emergency help. Help them to continue to use the inhaler as needed. Keep checking their breathing, pulse, and level of response. If they do become unresponsive at any time, treat a casualty who is unresponsive. So remember, reassure them. Help them to use their reliever inhaler. If the attack is severe, call 999 or 112 for emergency help and monitor their level of response. If they become unresponsive, treat as an unresponsive casualty. And that's how we help someone with an asthma attack.
If someone with asthma has an asthma attack, you can help them. Get the person to sit comfortably. Talk to them calmly and explain you are going to get their inhaler.
Dad, come quick. Victoria's having an asthma attack.
Quickly and calmly get their inhaler.
Don't worry. Just need to relax. I've got your inhaler. Breathe slowly, remember? You'll be fine.
Well done, Joanna. Victoria, you're going to be okay. Just try to breathe slowly.
As their breathing becomes easier, ask them if they're okay.
That's good.
If using their inhaler does not seem to help, or they do not have it with them, tell an adult and call 999.
First aid in disasters. Disasters are natural, technological, or human-induced, undesirable events that interrupt or disrupt human life and cause social, economic, psychological, and biological losses. Disasters negatively affect personal and social life and cause significant losses. Individuals with intellectual disabilities are among the disadvantaged groups most likely to be negatively affected by disasters due to their limitations in cognitive functions, lack of self-protection skills, and limitations in making correct and fast decisions to reduce the negative impact of disasters. Thus, individuals with ID should also be provided with disaster preparedness, protection, and first aid skills. Earthquakes are natural events that cause short-term tremors in the earth as a result of fractures in the earth's crust. Turkey ranks third in the world in terms of casualties due to earthquakes and eighth in the world in terms of population density affected by earthquakes. Individuals with intellectual disabilities are also among the groups that are likely to be harmed in earthquakes due to their limitations in cognitive functions, especially their inability to have protection skills during earthquakes. Thus, they should be also provided with earthquake preparation, protection, and first aid skills during and after earthquakes. These videos are on the earthquake during and after earthquake skills.
In this video, you will learn how to protect yourself and how to behave properly during an earthquake. An earthquake is one or multiple series of vibrations on the ground that can cause serious damage to persons and property. During an earthquake, do not run away. Falling objects represent a danger. If you're inside, take shelter under a sturdy piece of furniture or in the corner of a wall. Stay away from windows and mirrors. Do not face them. Cover your head and neck. If you're outside, stay away from buildings and everything that could collapse. If you're driving, pull up your car at a safe distance from everything that could fall down. Stay inside your car until the earthquake is over. After the earthquake, be careful, there might be aftershocks. Listen to the radio for safety instructions. Close the water and gas inlet taps.
Open windows and doors in the event of a gas leak. Leave the building. Don't use an elevator. Make your way to an open space. Eventually, head for a meeting point. Take your personal documents, warm clothes, and essential medication with you. Walk in the middle of the road and pay attention to falling objects. Don't smoke and don't light candles because of an explosion risk. Don't touch falling power lines. Don't make phone calls in order not to congest the telephone network. School children are taken care of at school. It is dangerous and not necessary to pick them up. Block access to damaged buildings. Stay away from coastal areas as there may be a risk of a tsunami. Make sure that your neighbors, especially if they're old or handicapped, do not need help. How to address the risk. Familiarize yourself with possible natural catastrophes in your country and safeguard measures. Arrange a meeting point for your family. Prioritize earthquake-resistant house constructions. Select your shelter areas. Store dangerous items properly in order to prevent them from falling. Secure devices and heavy pieces of furniture. Prepare your emergency disaster kit and first aid kit.
What do we do when an earthquake strikes? If you're inside of a building, make sure to stay calm. Stay away from fixed shelves, cupboards, and windows. The next step is to create a life triangle. You can create a life triangle by getting under a sturdy table or desk, or staying close to a sofa and hanging onto it. This method is a part of a series of actions called drop, cover, and hold. Drop to your knees to prevent falling. Cover your head and neck with one arm and hand. Bend over to protect vital organs and hold on until the shaking stops. And make sure to have your emergency kit on hand. These steps are crucial in saving lives and reducing the risk of injury during an earthquake. If you're outside, stay outdoors. Stay away from buildings, trees, and power lines. Crouch down to protect yourself from any falling objects. Also, make sure to stay away from the scene where there's a risk of a tsunami and any area that might experience landslides. Earthquakes might catch you by surprise, but knowing these few steps can be crucial in keeping yourself safe.
And fire. Fire is the chemical process in which a substance with flammable properties reacts with oxygen and emits heat to its surroundings, and the combustion event that goes out of control is called fire. In daily life, fires occur due to imprudence, carelessness, negligence, accidents, natural events, sabotage, etc. Other than domestic fires, wildfires are seen especially in summer seasons and damage to community life. Individuals with intellectual disabilities are individuals who have poor self-protection skills in fires and need the supervision and support of someone else. Fires can cause serious losses as a result. The damage of fires can be reduced with the measures to be taken before and after the fire. This is 2 videos on the fires.
Did you know that fire moves very fast? That's why it's important to know what to do if there's a fire in your home. You and your family should talk about how to get everyone out of your home quickly and safely. Make a plan and practice it at least twice a year. A plan will make sure that you all know what to do when you hear the smoke alarm sound. Work together to decide how to get out of every room in your home quickly and safely. Then practice your plan to be sure everyone understands it. Everyone who lives in or visits your home should know 2 ways out of every room. One way would be the door. The second way out might be the window. The plan should include where to meet outside after everyone has gotten out. Everyone needs to know where your meeting place is. Remember that the sound of 3 beeps and a pause over and over means there is smoke in your home. Everyone should follow the fire escape plan to get out. Some family members or guests might need help getting out. Infants and children will need help to wake up and get to safety. Be sure to plan for this and know who will wake them. Older children should know the plan and practice getting out on their own. Older family members or those with disabilities may also need assistance to get out. Make a plan for helping them too. Practice closing all the doors behind you as you leave. A closed door will help prevent the spread of the fire. Once everyone is outside the home and at your meeting place, call 911 for help. Never go back into a burning building. Once you are out, stay out. Practice your plan with a fire drill at least 2 times a year, in both the daytime and nighttime. You can help keep your family safe by having working smoke alarms and talking about and practicing your fire escape plan.
If your house catches on fire, what should you do? You and your family should have an escape plan that you practice together a couple times each year. Start by drawing a map of your home showing all the doors and windows. Be sure you know 2 ways to get out of each room safely. Have a meeting place outside of your house where everyone knows to meet that is a safe distance away from your home. Be sure that your house has smoke detectors. Smoke alarms should be in every bedroom, outside your bedroom, and on every floor of your house, including your basement. Have your parents push the test button on each smoke alarm once a month to be sure they're still working, and always check the batteries. If you hear the smoke alarms go off in your home, get out as fast as you can. If there's smoke, get low and crawl to the nearest way out. Close doors behind you as you go through them. Don't worry about taking things with you. It's important that you get out quickly and safely. Get to your meeting place outside and call 911. If you don't have a cell phone, you can use a neighbor's phone. Never go back inside of a burning house. Tell a firefighter if there's a person or pet left inside. If you have any questions, just ask an adult. It's best to always be prepared and safe.
In the next lesson, we will study on teaching emergencies and first aid skills to individuals with intellectual disabilities. Thank you for watching.